So, Dr. Mitchell, thank you for coming here to our next interview for the American Association of Black Physician Scientists. Really appreciate it. So, Dr. Mitchell, your journey is kind of taking you all over the Midwest, from Chicago to Iowa, now to Ohio State. So how has the journey been to becoming a physician scientist?
That's an excellent question. It's been, I would say, circuitous in a sense. So most people, they'll have, I guess, dreams of becoming a physician from a very early age, but it wasn't necessarily the case with myself. I actually wanted to be an electrical engineer. And so from grade school all the way up through college even, I was in all of the engineering clubs, I was in the engineering competitions, and then, quite frankly, when I was in my, I think it was my sophomore year, end of my sophomore year, junior year, I had an internship, engineering internship. It was great as far as the pay was concerned. It was problem solving that was involved, but what I realized is that the problem solving didn't, I guess, include the patient, or not patient, but person interaction that I had hoped. So right then and there, I had a very, I guess, deep lull for, man, did I make the wrong decision? And at the same time, my friend, who's surprisingly my wife, she was just like, hey, why don't you consider being a physician or a doctor? And because she's the type of person that doesn't just say things but means what she says, I thought about it, and it was from that point forward that I started pursuing a career in medicine. Now, the interesting thing about that, though, was as I was making the transition from engineering to medicine, my desires for engineering were totally rock bottom, so I stopped caring about my grades, I stopped caring about that major, and unfortunately had horrible grades. That was the first time I had ever seen all the letters of the alphabet on my transcript. So unfortunately, I was dropped from the College of Engineering, I was dropped from the college, and then I was placed in the College of No Degree. Yeah, exactly, I didn't even know that existed. So I was in the College of No Degree for that summer, and then turned everything around then, as far as I had one chance. You take these summer courses, you have to do well, if you don't, you're out. So I went ahead and knocked things out like I should have in the first place, and then the rest was history as far as the grades are concerned. The thing was, because of that semester and those prior to that, my GPA, even though I did very well the last 2 years, it still wasn't competitive enough to get into medical school. So I actually had to go through a post-bac program. So I went through a post-bac program and then entered into medical school, and then from there went on to where I am now.
Wow, it's quite an amazing journey. You definitely, it's not a straight road for you. It wasn't like A to B.
That's right.
But you're here and you made it. Were you the first gen in your family to want to go into college or to go into medicine?
Yeah. So my parents, neither one went to college. My dad, straight out of high school, he had a trade, so he went ahead and started working out of high school. My mom had an associate's degree, but no one completed 4-year college. And then from there, of course, no one went to med school. But the main thing that they emphasized, which catapulted me, was the fact that they constantly emphasized you can do anything that you want to do, and you can be anything you want to be. That don't be intimidated by anyone or their position, because they're all people, and you're just as good as them. And you know how it is. If your parents say something, you actually believe it. And I internalized it to a point where it was just second nature. And so it was just one of those things where you just pursue excellence, and then you just end up where you end up.
It's amazing, again. So did your earliest dreams in medicine kind of involve research at all?
That's an excellent question. So if you ask my mom, she would say yes, because I think in 5th and 6th grade, and maybe even sooner than that, during the summertime, of course, I wanted to just be done with school and take a break. But I think every single summer I was enrolled in some type of enrichment program, whether it was for instance, Chicago State University or University of Chicago, or even the Illinois Institute of Technology. It was always some enrichment program at some college, looking back. And so at that time, I had various experiences with research, in the sense of, I guess this one enrichment program allowed us to see paramecium. So I was able to see under a microscope what they looked like, understand the cilia and how it was involved in their movement. And I think I went home and just talked about what you learned to your parents, and of course, they were all amazed. And so from that point forward, my mom said she felt that I had an interest in research, but I don't know, at that point, and even going into college, I didn't necessarily have a desire to do research.
Okay. So when did this desire come about then?
Yeah, no, great question. So once I was in the post-bac program and entering into med school, you look forward and say, okay, what do I need to be competitive as far as residency is concerned? And over the summer, what can I do to earn some money? So those two things, and I talked to people and they were like, hey, why don't you enter into a research program over the summer? I was like, research? I was like, oh man. I was like, well, okay, let's do it. So I actually went around to various professors at Rosalind Franklin University asking if they had any openings, and one particular professor did, Pastor Crucero, and he allowed me to join, and I was doing that research for, 8 weeks? And that was my first interaction with like any type of real research. I mean, we experimented with rats and mice, and the interesting part was we experimented with drugs. So we wanted to see the effect of cocaine and amphetamine on the CAR-T peptide. And so it's like you're injecting these mice and these rats, and the mice were a little bit more aggressive than the rats, but the one particular time we had miscalculated the dose, so these rats were being actually overdosed. So at one point, when I went to get the rat out the cage after the experiment was done, I mean, his claws were just like in the cage. He just wouldn't move. And I was like, is he alive? So I went to touch him. He jumped out the cage, started scurrying all around the room. I was like, oh my gosh. I was like, how am I gonna do this? So I literally jumped down on the ground, had to corral the rat, put him back in the cage. And I told my mentor, he was like, okay, all right, let's go back and let's figure these calculations out. Lo and behold, we were ODing the rats, unfortunately, poor rat. But we figured it all out, and through the rest of that experience, I was like, now I get it. Now I can see the interconnection between figuring this out and how I can translate it to the clinic. So I was like, all right, that sounds fun. So the following summer, I did the same thing. Wanted to have a research experience, and this time, because I had that first time experience in the lab, I had a different mindset and a different hunger for it. And that, in turn, with my mentor at the time, Anthony West and Maria Ortigela, they both saw that I had the curiosity and the acumen to do research, and they were like, hey, have you thought about the MD PhD program? And I was like, the MD PhD program? What is that? So I investigated it, and I was like, wow, okay, that's exactly what you do, bench to bedside. This will allow me to touch people a little bit more like I want to, and it'll give me an idea and a connection with the research and different ideas to improve treatment. So that's when, literally, the second year of med school is when I applied to the MD PhD program and got in, and the rest was history.
Very nice, very nice. So going through med school, then you decided to join the MD PhD program. You were obviously very successful in that role, and then you didn't stop at that point. Once you got into residency, you continued doing research to the point where you're able to, which is often a very difficult thing for MD PhDs to continue in their residency. You were able to get the Röntgen Resident Fellow Award, you're able to get the Astro Resident Seed Grant. So how are you so successful as a resident and kind of continuing on your research pathway?
Yeah, I think one of the biggest keys was figuring out a residency program that aligned with what you wanted to do. So in radiation oncology at the time, there were almost 200 programs, give or take. Well, I would say maybe not. But there were an exceptional amount of programs, and you had to do your research to figure out who believed in you getting protected research time during residency or not. So there's one train of thought that people believed 12 months is enough. That will allow you to get the proper research training and the clinical training, because radiation oncology residency is 5 years, 4 years specific to RadOnc, 48 total months. And then there's the option of doing what I did was the Holman pathway, which allows you even more protected research time without extending your residency. So essentially what you're doing is you're shrinking the amount of clinical training that you have, 21 months of clinical training, 18 months of research. So I looked at each program to see their record for home and pathway residents. And then when I went on the interviews, I was upfront with them and I said, I'm interested in the home and pathway. How do you feel about it? And you can talk to someone and then like that micro expression, or overtly, they're like, no, we don't like that, we don't do that, we're not looking into that. So my rank list was just like that. And so when I talked to Iowa, interviewed with them, they already had 2 people on the home and pathway. That's what they wanted to do. They were supportive of it. They were actually supportive of whichever role you wanted to take. And that's how I matched there. And once I matched there, it was important to find a mentor now who would mend with you, of course, personality-wise, but also research-wise. And so I interviewed various faculty members, and then Michael Henry, his project lined up with what I wanted to do. And then we came together on the project, and that's how I was able to achieve or get the Astral Seed grant. And then from there, I had John Watkins, who then wanted to help me, mentor me on the clinical side. And so those 2 together, it just worked beautifully. So that was the key. I mean, finding out which programs actually aspired to do what you wanted to do.
So what would you say to our members of AABPS then who are kind of trying to figure out how do I continue my research in my residency career? Would you say be very upfront with the people who are interviewing you?
Yeah, I would say, a great question. I would say the number one thing is to figure out exactly what you want to do. And not in the most specific sense, but at least in a generalized sense. You say, I want potentially this type of training clinically and this type of research focus, and then maybe this type of career as far as academics versus private. And then if you can narrow it down sort of to that general aspect, or that general picture, I think then you start to choose your program and you go from there. And then, yes, I would say in the interview process, be direct, be upfront, ask them questions about how they feel. And you can be very direct and just say, do you support this? Or you can simply just start asking them questions that basically are around what you want to do. What type of fellows do you support who want to do this type of research? Or what's your track record with I guess, MD PhDs who aspire to do it this way? So I think I would encourage definitely going in and asking questions and being direct.
Okay, that's wonderful. So you went into an very interesting specialty, radiation oncology, which is often very overlooked by medical students and MD PhDs. So what about radiation oncology made you very interested in it?
Yeah, so if we take a few steps back. So initially in med school, I wanted to be a surgeon, and I wanted to be a neurosurgeon. And so I interviewed three neurosurgeons. Well, yeah, 3 neurosurgeons in my first year of med school. And the type of lifestyle that they had was not congruent with what I thought I wanted to be or wanted mine to be. So I quickly ruled that off the list, but still wanted to possibly be some type of surgeon. So fast forward to 3rd year of med school when I did my surgery rotation. It was fun, I enjoyed it. But when I talked to the surgery residents, they emphasized you really have to have a passion and love, and this is the only place you want to be. And so because that wasn't the only place I wanted to be, I was just like, okay, this is probably not for me. Surgery is not for me, even surgical oncology. Because one step back, I knew I wanted to do something oncologically related because of the various things that had occurred with family members with cancer. So I wanted to be a part of the solution and help people not experience what I did. So I thought about medical oncology, but I still wanted a specialty that allowed me a more focused type of therapeutic option for patients. And so that was more generalized, systemic. You give, even though some of the treatments now are more targeted, it's still systemic versus localized treatment. So it was the 3rd year of medical school, and it was at the end, quite frankly. I was on my internal medicine rotation, and I told a friend of mine the predicament I was in. I was like, I want to do something oncologically related. I don't really want to do surg-onc or med-onc. What do you think I should do? And he was a year ahead of me. He was like, hey, I'm doing rad-onc. Why don't you check that out? I was like, what's that? What's radiation oncology? So I read a little bit about it, and I was like, okay. And then I saw that, oh, wow, they focus on research, and you would have a pretty good amount of time to do research that you would want. It involves some physics. It involves cool technological equipment. So during my internal medicine rotation, I asked it was the rotation director. I said, can I get this afternoon to go and check out this specialty? This radiation oncologist was going to allow me to rotate with them. They said, sure. So literally, one afternoon, I went and rotated with a radiation oncologist, and that was it. It was like, wow, I can build a relationship with patients. I can offer directed treatment to them. I can do research, and I can help cure cancer. So it was literally that afternoon, probably about 4 hours, that triggered it for me. And then from that point forward, I sought out after rotations in Radonc, and then it further supplanted that that's what I wanted to do.
So we're moving now into our second portion of our discussion, kind of talking a little bit more about your research that you currently do. But before we do that, I wanted to ask you, have you faced any challenges in medicine or in science as a Black man in medicine and science?
No, that's a great question. And when I saw that question and I was pondering it and thinking about it, I was like, well, not really any overt, I guess, challenges per se, in the sense of people trying to prevent me from succeeding. It was more so challenges of patients meeting me and not understanding that I'm not an anomaly. So I have a few examples for you. For instance, I think it was my intern year. I was on my medicine rotation. I was seeing an elderly gentleman. I think he had bladder cancer, but at the time, I was in Chicago. That's where the residency was, and we struck up a conversation about the Bulls, because I guess he assumed that I like sports. So then we started talking, and I think Derrick Rose had a great night, and he was like, wow, you people must really be happy. I was like, you people? I was like, okay. And so I had to ignore that and still treat him and understand he's older and he may not understand things quite well. But then fast forward to when I was in Iowa now, and a lot of times what happens is I walk into the room, people were a little surprised and they would say, so where are you from? I would say, I'm from Chicago. They were like, where are you originally from? What country are you from? I was like, no, I'm from Chicago. My parents are from Chicago. They were like, oh, okay, you speak so well. I was just thinking like, what do you mean? So I would try and use that as an opportunity to teach them and say, well, actually, I grew up, yes. No, that's how it would go. So once they found out that I was actually from Chicago, they were like, oh, what suburb? And I was like, no suburb. I was from the south side of Chicago. And then I would use it as a teaching opportunity to say, you know, actually the neighborhood I grew up in, all of us actually did pretty well, and our parents emphasized education. Because my friend across the street is a cardiothoracic surgeon, a friend around the corner is an engineer, another one is the owner of a business, and then another is a lawyer. So it's like, I'm not an anomaly. Just be careful of believing everything you see in the media, because that's not all that our community is. Then there was another instance, a lady asked where I was from, and I said Chicago, and she was like, wow, you know what it's like to grow up poor. And I was like, no, ma'am, not really. And then I went to explain my family background, and she really didn't understand, and she was caught off guard. So she was like, well, I know what it's like to grow up poor. And then finally, it was a gentleman who had a total laryngectomy, so he really couldn't talk. We built up a nice rapport, good relationship. I don't know how we got on this subject, but he was like, oh, he's writing this stuff down, so you have any kids? I was like, 4 kids. And everybody, everybody jumps back like, wow, 4 kids, you're busy, blah, blah, blah. But he was like, 4 kids? So he was writing something down. And I was like, okay, he's about to be excited. What is he gonna say? He was like, and I read it, it said, all by the same woman. I was like, come on, man. I was like, yes, sir. I was like, my wife, I met in college. We have 4 kids together, and we didn't have our first child until we were married. I was like, yes, sir. I'm like, it's not uncommon for that to happen. And he was like, oh, okay, I'm sorry. I just didn't know. And then he tried to like chum up with me and be okay. But I wouldn't necessarily call those challenges, but opportunities to just teach and just emphasize how we're not an anomaly, that people from our community within the inner city are capable. They have the acumen. They just need the opportunity, and you would be surprised how many brilliant people that you'll run into, and myself not included.
I 100% agree. That's part of why we created AABPS, to kind of form a community to kind of show the world that there's many of us out there. You just don't know where we are.
Exactly.
All right, that's fantastic stories after stories. So let's talk a little bit about your research. So I saw that you're one of the head investigators on a clinical trial that's slated to actually end at the end of this year for a radiation therapy for head and neck cancer. So can you explain to the general layperson what the goals of the clinical trial are?
Sure. So right now we're trying to find better ways to give treatment for non-HPV related head and neck cancer. And what is this whole non-HPV scenario? Well, head and neck cancer can be commonly caused by the human papillomavirus or not. And those that are not caused by that virus are particularly aggressive and resistant to treatment. So what this trial is looking at is, okay, this is the standard of care, radiation plus chemotherapy. If we add in another treatment that actually targets specific receptors in addition to the standard, can we make it better? So that's what that's trying to do. And it hasn't been easy, but that's one step closer to trying to improve treatment.
So it's ending at the end of this year, and you're getting the primary results. So then, what do you think will happen? What's the next step?
So usually if it's the phase 2 portion of a trial is usually just trying to see the efficacy of the treatment, and then once they see it's efficacious and it's tolerable, et cetera, then they move on to a phase 3 portion that usually compares it to the standard of care. And so if it's favorable, if it has some sustainable results, then it will be moved to a phase 3 trial.
And then hopefully down the road, becoming a drug that person can take. So you also work as part of the molecular carcinogenesis and chemo prevention program. So what are the goals of this center?
Yeah, so it's one of I believe 4 or 5 different programs in the Comprehensive Cancer Center that brings together all scientists and physician scientists who do research in I guess genetics and environment and the interface of how those come together for cancer, meaning that they're trying to figure out which genes are involved with the cause of cancer in order to prevent them and which environmental factors are involved. So for instance, if we can figure out which, for instance, dietary changes, nutritional food products, or even phytochemicals, for instance, in plant foods, can either prevent certain cancers or can additionally add on to the treatment of cancer, then we can make some great strides and attack cancer from a different aspect.
Okay. So how do those goals fit into your personal goals and aspirations and your research?
Yeah, basically the co-director of the MCC is my mentor, my primary mentor, Steve Clinton. And right now we're working on our project where first we noticed that patients that undergo radiation and chemotherapy have cognitive changes and deficits after treatment, partially due to the malnutrition that occurs during treatment. So what we're trying to do is we're trying to measure so we know that phytochemicals such as lutein and zeaxanthine are involved in neurocognitive changes. And we know that, we hypothesize that part of this malnutrition that occurs in these patients that go through all this treatment, part of that malnutrition includes zeaxanthine and lutein. So what we're trying to do is first measure those different phytochemicals with various modes or various tools, show that we can utilize these tools to accurately measure these phytochemicals, and then do an intervention studies to try and prevent neurocognitive changes after treatment.
Okay. Very, very interesting, very cool. So in the next 5 to 10 years in your lab, what are some promising areas that you and your colleagues are working on?
Yeah, so besides the side effect profile of patients that receive chemo radiation, we're also looking into incorporating nutrition with the immune system as well in order to improve chemotherapy and radiation, whether that's to prevent certain side effects from the treatment or whether that's to improve the current therapy that we have. So right now we're in the process of writing a grant that's looking at, for instance, intratumoral vaccinations in combination with PD-1 inhibition and radiation, and whether or not that can improve the outcomes of recurrent head and neck cancer. And then the third aspect would be, of course, a little bit more of radiosensitizers, finding different targeted therapies that can improve radiation so that we can lower the dose that we give to patients, thereby still maintaining the outcomes, but then decreasing the side effects from it as well.
Okay. So are you working primarily with, like what kind of patient population are you interested in? Is it for anyone who's had metastasis, or is it just like stage 1 cancer? Where do you fall on?
No, that's good. So, I mean, honestly, it's all but most of these trials and these studies are dealing with the locally advanced cancer patients, stage 3, stage 4s, and then in the recurrent metastatic setting, yeah.
Is there anything in the center for just the stage 1, stage 2s that someone in the molecular carcinogenesis center is working on?
Not that I can think of off the top of my head. I mean, there is Dr. Steve Agumu who's looking at oral cavity cancer and immunotherapy, and he has a beautiful mouse model that occurs. But again, I think that's more for advanced cancers. I mean, ideally what we would hope is that you can use a single modality for stage 1 and stage 2, thereby, of course, decreasing the morbidity and the side effects from it. So, but right now, usually stage 1 and stage 2 because they have such great outcomes. Yeah, I mean, actually though, there are some ideas, for instance, with stage 1, stage 2 HPV positive cancer, where we're really trying to find ways to stratify patients who will do well with lower amounts of chemo and radiation therapy. So those trials are out there. University of Chicago, for instance, has done a couple of trials, Optimum 1 and 2, that have shown some promise. Mayo Clinic has done some. And we have tossed around ideas of trying to make one of our own. So, I mean, yeah.
All right. So then, kind of taking a broader view, so why specifically head and neck, and why specific HPV negative cancer? Because the cancer field is so broad, so diverse, so why did you decide to focus in on this area?
No, that's a great question. So for me, originally I was coming after doing prostate cancer research, and a lot of times when you come to a job or a new institution, you usually fill the role that's needed. So even though I had requested to treat, for instance, prostate cancer patients or even pediatric patients. At the time, they had plenty of physicians doing that, and there was a need for head and neck cancer, radiation oncologist. So at that time, I was like, you know what? I'm trained in it. I can do it. Let's go for it. So once I accepted that offer, then I wanted to change my research to match what I was treating, and so I went into head and neck cancer research specific. And then what's the pull towards the non-HPV related? Well, the recurrence rate and the overall survival for HPV negative is much lower than the positive. Positive can get up to 90%, whereas oral cavity, for instance, can get maybe up to about 60% with early stage with locally advanced stage. So we definitely have room to improve treatment there. So that's why that's sort of been my focus.
So, did you feel like your training and your MD PhD training, your PSCP training kind of prepared you for, because you went from one field to another, did you feel like it prepared you well, even though you weren't in your particular domain that you had prepared for? Like, do you feel well equipped to make that change?
No, that's an excellent question. I think the biggest thing that the PSTP program showed me was the idea of foundationally knowing how to think and come up with different hypotheses and different projects, but just the idea of sticking to it and just getting through and being patient with things. Because I'm sure as you've experienced already, there are just many times where you're just like, man, do I really want to do this? And you're like, yeah, I definitely want to do this because I'm called to do this. And so I think understanding, having that basic foundation in project development helps you to switch and sort of apply what you already know to a different field of study. Now it was quite difficult though, because I was actually doing, and I mean even now writing a grant on something totally different than what I was trained in. But that's when you need the proper mentorship sort of to help you transition quickly in those scenarios.
Okay, so coming back to the research then that you're currently doing, so it sounds like research plays a huge role in kind of your clinical medicine career. So where's the balance at? Is it 75-25? Is it 50-50? Where do you strike that balance between research and medicine?
Yeah, so right now for me it's 75-25. And so initially when I arrived here year one, because I didn't come in with my own funding, it was flipped. So I only had 25% protected time, but fortunately I was able to get a proper mentorship from Quentin Pan, Arnab Chakravarti, the chair, and we were able to come up with a project that allowed me to get a K award, and then that's when the time, I guess the time split changed. And so since then, it's been 75% research, 25% clinic. And the key, I guess, to balancing that is just really being, I guess, firm in your time management and not being distracted no matter where you are. Because for instance, when I'm in the clinic, I have to be totally focused on the patient's needs, anticipate their needs, their care, and be totally on board. I can't be thinking about this grant that's due next week, or even this paper that I need to submit, or this experiment that just didn't work, or why isn't a list of things. And so it's all about, it starts in your mind, you get that focus, and then as long as you have that focus, then you can move forward there. And then once it's research time, then you need a great team that's able to handle clinical concerns that come up throughout the week. A great nurse practitioner, great nurse, great administrative assistant. So between the three of them, they're able to take care of most things, and then they know how to get in touch with me for things that definitely need my attention. The biggest thing for me is to allow them to do their job. Because sometimes I can go into IHIS, for instance, and look and see there's a patient call, patient advice, this needs to be done. And you want to go ahead and take care of it because you can, but you have to pull back, go and focus back on that grant that needs to be written because you need uninterrupted time. So I think that's the biggest thing, is trying to really carve out that time, have a good team that supports you, have a good chair that supports you, and then if you can do that, then you can adequately divide it up. There are many times, because of radiation oncology, you have to plan the patient, so you have to actually draw up the treatment plan. And sometimes I can complete that on a Thursday. I mean, because clinic can be from 7 a.m. to 7 p.m. And then after that, you're trying to work on that radiation plan that can take 2 hours, 2 to 4 hours to complete. So sometimes you can do that all in one day. It's not too common. So sometimes it'll bleed over into the next day and you have to finish that up. And some notes probably too. But for the most part, it's all about just trying to keep focus and be in the moment, do what you need to do at that time, and then focus on the next thing at that time.
It's a great balance. It's a juggling act. I'm sure you know. So this is a long journey to become a physician scientist. There's no denying it. So how did you stay focused? You talked about focus. So how do you stay focused on this journey?
Yeah. Honestly, for me, I can literally look back to two main points for me, and it was because I just know I'm called to do this. I mean, I prayed and had a peace to become a physician, and then when I made the transition to become a physician scientist, it was the same thing. I mean, that's what carried me through those 5 years of getting the PhD, when it just looked like it was just like no end, and you were just gonna be left behind by everybody. And that's even what's gotten me through to this point now, when you run into various hardships or obstacles or setbacks. I mean, because in grant submissions, I mean, you're gonna hear a whole bunch of no's before you hear the yeses, and you just remember the no's versus the yeses. So the fact that it's a central piece within me and knowledge that I know I was called by God to do this, that's it. I mean, because you can strip away everything else, and you can strip away any money, any notoriety, anything, and then you're left with, is this what I was called to do? And it's like, yeah, I can't see myself doing anything else. So it's like, well, just be patient, stick to it, and the time will come when it will turn around.
It's a wonderful message. It's truly, truly great. So you've obviously had mentors along the way. You've already mentioned a few of them already. Thinking back, who are your mentors that stick out in your mind, and why were they so instrumental in getting you to where you are today?
Yeah, so I mentioned Pastor Crucero, who was at the very beginning, and he stands out because he just showed me what it looks like to run a lab and run it very, very organized and to keep great data and great records so that you know how to proceed forward when you do get the data and how to follow it. And then Anthony West and Maria Ortigala, they both showed me how I can incorporate and do the bench to bedside phenomenon that occurs with the physician scientist. And then of course John Bradley, he was key with the post-bac program that allowed me to get to that point. And even still, he was the one that actually really encouraged me to do hard things, because he allowed me to take the route that was untraveled and that was particularly the hardest route in the post-bac program. And he just threw me in the water and I was able to survive. So that was paramount. And then my PhD mentor, Joe DeMario, he was great at being hands-off and allowing you to understand and find out how to do research, but always available to answer questions, but not necessarily do it for you, because he wanted you to try and figure it out and understand it. And I thank him for that. And then, so that was literally med school, graduate school, and then when I got to residency, I mean, the chair of the Iowa program, John Boati, to this day, we were, I would say, good friends. He was very supportive of my goals. He made that clear when I interviewed, and he held through to it as I went through residency. And then Doug Spitz, Michael Henry, both of them were important with actually doing the research and thinking like a scientist, not worrying about your hypothesis being wrong, but just following the data and how exciting that is. So that was very important. And then now here, Quentin Pan, John Bird, who recently just left, and then Steve Clinton, who's my primary mentor, Arnab Chakravarti. So all of them together combined just add different aspects of what it is to love research, proceed forward with it, how to manage being a physician scientist, and then just enjoying the whole process of going through the ups and downs of course, grant writing, manuscript writing, managing a clinic, etc.
Oh, that's awesome. So moving into our final section of our discussion, so a little bit about your personal life, kind of your hobbies, kind of what you like to do outside of work. So how do you juggle your family life and your work life?
That's a great question. One day at a time. and so to be honest, and it changes, it evolves as you progress in your career. So I actually got married when I was in the second year of the PhD portion of the MD PhD program. So yeah, that was 2005. And then our first child was born the very next year, 2006. So and then 3 years after that, we had our second son. And then 2 years after that, we had our daughter, and that was the end of intern year. And then, 5 years after that, our youngest was born, and that was right before a board exam. So literally, I think each moment I tried to live in the moment. And I think the biggest thing that I was committed to was when I'm at work, do as much as I can. And then once I'm at home, I'm at home. I was to a point where I wouldn't check my email once I got home. And that would allow me to literally put work aside and be there with the family. And then any downtime that I would have, I would literally try and be there and interact with them. Not just present, because it's good to be present, but actually be involved and interact with everything that they need. So when they were younger, when they needed to be changed, or when it was time, when they wake us up at night, I would alternate with Janice so that she can get some rest and do what needed to be done. I remember one particular time, I don't remember getting sleep. I just remember waking up, and then I think it was intern year. And at that time, that was right when Night Float was I guess they started Night Float. And so I actually had to do what I needed to do for the family. And then I was called in to substitute for somebody's Night Float who was sick. And it was the ICU. So it was all encompassing where you had to go home and do what you needed to do and go back to work and do what you needed to do. And again, it's that whole switch. You focus on what you need to focus when you're in that moment, and then you go forward. And I think trying your best to have things that you don't compromise, I mean, helps tremendously. And I think because even to this day, I don't even have, not saying that everybody has to do it my way, but even to this day, I don't allow myself to even check my email on my phone. I don't have that access. I haven't set it up yet, so that because if I feel if it's that important, someone will call me, and then I can address it at that point. But I usually try and have a line that I draw to not allow work to have access to me at all times. Since the pandemic, because I've been working from home, that line has been blurred quite a bit now. So now the kids will be in there while I'm doing work, and they're learning different things. They know how to knock on the door, slide in the door, and say, "Are you in a meeting?" or whisper or crawl. So I mean, it's been interesting, but I think trying to have those boundaries that you don't compromise on helps.
Okay.
Yeah.
Speaking of things you don't compromise, is there any hobbies that you enjoy that you just like, I have to continue doing this to kind of, it helps me relax?
Man, that's an excellent question, because it's like, do I have hobbies that I enjoy? The question should be, do I have hobbies that I want to do? So I mean, one is golf. So I've always wanted to golf, and last year was the most I ever golfed. So that was phenomenal. So in my mind, I have a great game, but the ball, doesn't go where I want it to go often. So usually, I want to golf more. So that's one hobby. I mean, I do want to read other non-medical books. I bought all these books and I started reading them, and then I got interrupted, of course, by work and other responsibilities. So I do like to read just different, I guess, autobiographies, and then different books recently about, I guess, being a leader, etc. And then what else? Regular things like other people going to the movies, going out and outside with the family, etc. I mean, those are the main things. I mean, before that, see, honestly, that's what I'm thinking about. I don't even remember the hobbies that I used to do or like doing prior to all this. I mean, it's interesting, but I mean, yeah, I try and get away and get some time to myself, whether it's with friends too, going out and just hanging out as well. Oh, I used to bowl. That's what I used to do, but I had my own ball and everything.
Were you any good?
Yeah, I think so. My highest game was that I think my highest game was it 269? Maybe, yeah. My dad bowled a 300, so yeah, I still haven't done that just yet. But yeah, I used to love bowling. Used to love it. But I had my own, like I just told you, I had my own ball with my name engraved on it, had my own shoes. But yeah, maybe that's another thing I'll get back to doing one day. Yeah, I'll let you all know.
Okay. So you like to read too. So you mentioned you like to read. So is there any quotes that you like? Any favorite quotes that you try to live by?
You know what? No, not really. I mean, the one quote I constantly think about is actually from the Bible. I keep thinking of like Colossians. I think it's 3:18, and it talks about working with the work that you do, work unto the Lord. And I think that's sort of the thing that allows me to be detail oriented, and the times when I'm the most tired and most exhausted, to call the patient after clinic and explain to them and spend time with them on the phone about their questions, any and all questions, or that note that needs to be detailed enough so that everybody can know, or that plan that you do need to focus on the margin and that organ at risk. So I think it's that, because at the end of the day, you can just say, it doesn't really matter, but it does matter, because I mean, I have to answer to him. So I think that's the quote that comes to my mind, I guess, right now, for the most part, that I try and live by. And then that helps me to try and focus on being like a servant leader, and it not being all about me, but trying to help others out.
So speaking of helping others, then what kind of approach do you take any mentoring for the next the next generation of physician scientists? Like, what's your approach towards mentoring?
Yeah, I think for me, the biggest thing is to get to know the individual and see what their aspirations and goals are, and then sort of tailor it towards that, and then helping them to obtain the resources that they need, or pointing them into the direction that they need to go. I mean, I think the biggest thing is helping them understand that everybody's journey and path is slightly different, sharing my story, and then helping them to get through whatever they need to get through in that fashion. And then I think, so that's just the total person. I think with choosing a specialty or choosing the type of research you want to do, again, that goes with knowing the person, and then just talking to them, just really verbalizing to them and getting them to understand what it is that they're moved to do or passionate about versus trying to tell them what they should do. And then once I figure that out, and then it's more so me sort of helping guide them in that direction. But I just welcome it. I just want people to just come and ask me questions, and I just want to be there to help them.
That's wonderful. So our last question today, after this wonderful interview, is we have our students who are going to watch this, and they're wishing that they're wishing to become you. They're wishing to be sitting in that chair hopefully one day. So what advice do you have for them, on their journey to becoming a full physician scientist?
Yeah, that's an excellent question. So I can remember, I think it was my second year of med school, and going in on a panel of physicians. And they were all black physicians, and seeing them as attendings and looking at them like, wow, how can I get there? How will it be once I get there? And then hearing their stories and how they got there, and then now being on the other side and saying, wow, that was a fun journey. I think the biggest advice I would have is to expect to encounter difficulties, and don't think just because you're coming upon barriers or difficulties that something is wrong with you. Sometimes you encounter those things and you go through those things because not only is it giving you more fortitude and understanding about who you are and what you can accomplish, but it also gives you a story and helps you to then guide the next person and the next people. In general, it's going to give you a greater, broader understanding of the world and the people you encounter, and ultimately it's going to make you the best physician scientist that you can become. So I would say expect it, embrace it, walk through it, and constantly get advice and help from those around you, those who've gone through what you have gone through, and even the colleagues that are walking alongside with you as well. Don't constantly compare yourself. That's the second thing, I guess, a little tangent. Don't constantly compare yourself with others. Because as we know, we go through this, and it starts with the PhD. Wow, they finished theirs in 3 years. Wow, it took them 6. What's wrong with me? It's taking me 5. It's like nothing's wrong with you. I mean, everybody's situation is different. I mean, their project might have been formulated already, and then they have all these other postdocs around them to help them. Whereas yours is more complicated and you didn't have as much resources or help. Regardless of the case, yours is different than theirs. Stop playing the comparison game, because if you play the comparison game and you start looking, like for instance, and seeing everybody's great pictures or blurbs on Facebook, then you're unfairly comparing yourself to the things that aren't the truth. So I would say just be who you are and go through what you're going through, get help when you need help, and be encouraged that we all have been there.
And wonderful, wonderful advice. Again, I want to thank you, Dr. Mitchell, for coming today. Thank you for allowing us to interview you, and hope our students, I learned a lot, and I think our students will as well.
Yeah, no, this was great. I really enjoyed this. Anytime. So, AABPS is an organization created for us and a place for us, people like ourselves, Black African American scientists. And we are not anomalies. There are many people like us. I think this is needed, and I'm glad it is here. Join AABPS.